Hello everyone, today we are going to discuss about the anatomical landmarks of maxilla. So the first thing when saying about this anatomical landmarks of maxilla is your limiting structures. So the limiting structures of the maxilla are your labial frenum, labial vestibule, buccal frenum and buccal vestibule. Okay, just let us discuss about each of them in detail. The first thing that we are going to see is your labial frenum. This is actually a single mucous float that extends from the mucosa of the lip to the residual alveolar ridge, which is nothing but, when you see here, my diagram is bad, please bear with it. So if I consider this as your mucosa of lip, from here it extends till the residual alveolar ridge, and this is called your labial frenum. Labial frenum. Alright. And now let us discuss about this in detail. This has to be functionally relieved in order to prevent any dislodgement. And the part of this frenum in the denture, while we are making denture, it would be like this. So this is actually a basic structure of a denture. Maybe I'm so bad at drawing, please bear with me. So this part is the relief that you are giving in the labial frenum, and this part is called labial notch. So we call this as the labial notch. That's what I've given here. In case if your labial frenum extends from this mucosa to the residual alveolar ridge, if it is very close to the tip of the alveolar ridge, then you have to undergo a process called frenectomy to prevent further things. Okay, that's what I've given here. And this labial frenum is actually dividing your labial vestibule into two parts. So this divides your labial vestibule into two parts. That's what the labial frenum ends. Then the second thing is your labial vestibule. The corresponding area in the denture, and that this area is called your labial flange. We call this as the labial flange, and there is no muscle attachment even for the labial frenum and labial vestibule. Okay. Usually it is properly covered to prevent any dislodgement, and the superior border of it should accommodate the mucogingival junction, and its extension is from the labial frenum to the buccal frenum on either side. Okay, so with this the labial frenum and labial vestibule comes to a conclusion. Now let us discuss what is there in the buccal frenum. So the corresponding area in the denture, we call this as notch. Basically for frenum you call notch, and for vestibule you call this as flange. So this buccal frenum is called buccal notch. And there are three muscles involved with this buccal frenum, and they are levator anguli oris, orbicularis oris and buccinator. This orbicularis oris pulls this buccal frenum forward, whereas this buccinator pulls it backward. So these are the muscles that are attached with this buccal frenum, and the corresponding area in the denture is known as buccal notch. That is what I was trying to say in this buccal frenum. And now let us move to the buccal vestibule. Here, if you see, it extends from the buccal frenum to the hamular notch area. So the hamular notch area is nothing but this is your maxillary tuberosity area. This is going to be a little bit elevated in your cast if you see it with cast. So this area beneath this, this area beneath the maxillary tuberosity, this area is called as the hamular notch. Okay, so from your buccal frenum to the hamular notch is your buccal vestibule. Okay, this is what is the extension, and as I already told, the flange is a name given to the vestibule in the denture. So this is buccal flange. And there is one interesting clinical feature in this buccal vestibule, that is the coronomaxillary space or retrozygomatic space. Okay, this coronomaxillary space is nothing but it is the distal end of the buccal vestibule, and this space is influenced by coronoid process of the mandible as well as the maxillary bone. So anatomically it is a part of infratemporal fossa, whereas clinically it is buccal vestibule. Basically, so the part of the denture that fills up this coronomaxillary space is known as retrozygomatic eminence, because we call this coronomaxillary space also known as retrozygomatic space. So the part of the denture that fills up the space of coronomaxillary or retrozygomatic space is known as retrozygomatic eminence. You got it? Now let us see what this hamular notch. The other name for this hamular notch is pterygomaxillary notch. Actually, this is present distal to the maxillary tuberosity. In between, there is some extension given for this hamular notch. That is, it is present between the distal end of the maxillary tuberosity and anterolateral and hamulus of medial pterygoid plate and hamulus of medial pterygoid plate. Okay, this is located with the help of T burnisher, and any extension of this denture beyond the hamular notch will lead to dislodgement and discomfort. So this is your hamular notch. Now let us discuss about the posterior palatal seal area. Actually, it is the junction between your hard palate and your soft palate, and this area is called as your posterior palatal seal area. This area, all right, this area, posterior palatal seal area. Any pressure applied on it, the pressure applied on this area help in retention of the denture. Okay, it is actually extending between anterior. It is actually an imaginary one. This is actually something called imaginary one. No such structure is present in your oral cavity. So yeah, this extension is, if you see, it is anterior vibrating line and posterior vibrating and laterally hamular notch. This is actually having cupid bow shape, as you see here. And this posterior palatal seal area can be divided into two, and they are pterygomaxillary seal and postpalatal seal area. This pterygomaxillary seal area is 3 to 4 mm anterior lateral to the hamular notch. That is the part that is present near to the hamular notch, 3 to 4 mm anterior lateral to the hamular notch. This area is known as your pterygomaxillary seal area. This is also your pterygomaxillary seal area. This in between area, this is called your postpalatal seal. Postpalatal seal area. All right. So this is your limiting structures of maxilla. Hope you got it. So what are the limiting structures of maxilla? Labial frenum, labial vestibule, buccal frenum, buccal vestibule, and you have your posterior palatal seal area and hamular notch. So both are mucous folds. Okay, they both do not have any muscle attachment. Here it is relieved, it is included. Then this corresponding area is labial notch, and this prevents dislodgement when given an relief. All right, labial vestibule divides the labial vestibule into two. This labial vestibule, corresponding area flange, labial flange, no muscle attachment, and it should be properly covered to prevent any dislodgement. Superior border should be near the mucogingival junction. Extension, if you see, it is from labial frenum to the buccal frenum. Then your buccal frenum, buccal notch, 3 muscles involved: levator anguli oris, orbicularis oris, buccinator. Orbicularis oris pulls it forward and buccinator pulls this backward. Then you have your buccal vestibule. Okay, this extends from buccal frenum to the hamular notch. Then corresponding area is buccal flange, and under this there is a space called coronomaxillary space or retrozygomatic space that is present distal to this buccal vestibule, and this is influenced by the coronoid process of mandible and maxillary bone. Anatomically, it's a part of infratemporal fossa. Clinically, it is a buccal vestibule. It's called buccal vestibule. The part of the denture that fills up this coronomaxillary space or retrozygomatic space is known as retrozygomatic eminence or coronomaxillary eminence. So when coming to hamular notch, it's also called pterygomaxillary notch. It's a loose connective tissue that is present posterior to the maxillary tuberosity. That is, it is present distal to the maxillary tuberosity and hamulus of medial pterygoid plate. And it is a limiting structure, as you see, and any extension beyond this may cause dislodgement and may produce discomfort to you. Then your postpalatal seal area, it is actually a junction between your hard palate and your soft palate. Any pressure applied on it aid in retention, and anteriorly it is present. If you see extension of this, then it's going to be anteriorly anterior vibrating line, posteriorly posterior vibrating line, laterally hamular notch. It's actually cupid bow in shape. The division of this, we can divide this posterior palatal seal area into two. They are pterygomaxillary seal area and post-palatal seal area. This pterygomaxillary seal area is actually present 3 to 4 mm anterior lateral to the hamular notch, and post-palatal seal area is between pterygomaxillary is present between two pterygomaxillary seal area. So as I have seen here. So you got it now. Thank you.